Austin-Weston, the Center for Cosmetic Surgery, is proud to present the New Now podcast, today featuring Dr. BYRON Poindexter. And now, here's your host, Rebecca Bennett, and Dr. Poindexter.
What is like the textbook definition of a facelift, and do all of these different types of surgeries have one thing in common?
Oh, great question. A very big answer.
We're back.
Thank you for having me again, or still.
Thanks for having me in your office. So we issue these on Saturdays. So you were in today seeing a patient. What surgeries did you do this week?
Oh, so this week, that's a long time for me to try and remember. Yesterday, I did 2 liposuction cases. Earlier in the week, I did tummy tuck case, and even earlier in the week, I did a facelift and some facial rejuvenation surgery. So I've done a little bit of everything this week, and I did a breast augmentation as well. So I've pretty much covered everything head to toe.
Busy.
It's a good way to be.
Over the last couple episodes that we've shot, I've just been kind of impressed at the amount of days of the week that you guys actually perform surgery at Austin-Weston. Is that pretty typical at other plastic surgery centers?
Not really. So there's a more standard model where people will have operative days, and then they have what they'll call clinic days. And those are the days that they see people that have had surgery or patients that are potential surgery clients or patients. And so you see them, and then they'll have a different day. You go to the hospital or to a surgery center, you operate, but you typically don't see patients back in the office those days, or you just see a few. And some people will operate 2 days a week, some people maybe 3, but it's hard to have another schedule, with more than that. We operate 5, as we choose to. I choose to operate 4 because I only come in 4 days. I've gotten to the point that that's the life I want. And it makes me a better surgeon, makes me a better person, makes me a better husband, when I have that extra day of decompression. But we have our facility here, and I can operate for 5 hours and be done. And then I've got another 3 or 4 hours to essentially do clinic right here. And I'm not traveling to the hospital or to the surgery center. Or if I finish my surgery 30 minutes late, and then the patients only had to wait on me for 30 minutes. They haven't had to wait for 30 minutes plus the travel time plus the da-da-da-da. So it's really nice and convenient, and allows us to have more operative opportunities.
Operative opportunities. So today we're talking about facelifts, and when is a good time to sort of schedule one based off of your own availability. There are questions: should I get a facelift in the summer? Will the sun affect my surgery? Should I get it in the winter? When you have maybe a potential patient coming in and sitting with you and asking about it, what do you typically tell them?
My stock answer is the best time to have a facelift is when you have the time to recover. So for a teacher, that's going to be in the summer, because that's when they have it. Winter break, you get a couple weeks. That's enough time to do something small, but it's not going to be if you want to do your full face. And there's different careers that have different times off. Accountants, there's a busy time of year. They're not getting anything done March, April. Or if you're a government employee, you're not getting it done in the fall because of that year. We're in the D.C. area, so we see quite a variety of schedules. So if you don't have a limitation based upon your occupation, then I can follow up with some enunciation. I can try and make this whole thing rhyme because it was starting to go well there. But if you don't have that type of limitation, then it's on your activities. What do you do outside of work, and how might this affect that? So people often choose to do things in the fall, winter, to get it done when they're not going to be out boating, when they're not playing golf or tennis, when they don't have those ancillary things going on.
Mm-hmm. And I would imagine also, if you're not in physical pain or discomfort, there might also be, how long does it take for someone to look quote unquote normal again? When the swelling goes down, maybe when bandages come off?
Yeah. So our book answer, our stock answer again, has always been that at 2 weeks, you look pretty presentable to strangers because they don't know what you look like. Of course, that's with makeup and then doing some things to camouflage, maybe wearing your hair differently for some of that. For people that you're going to need at least 3 probably, because they're going to be more nuanced in their perception of you. And you're still, if they're looking closely, or if they say, I haven't seen her in 3 weeks, why does she look so good, or why does he look so good? They're going to be able to look and be able to tell. So, in that circumstance, for the people it's closest, it's always just to be, honest and let them know you're having a little something done. Maybe you don't have to reveal everything. And then you can get back and see them a bit quicker.
And let's talk about the different kinds. I didn't know until today that there are so many, that it's not just like one facelift, one and done, that there are mid facelifts and mini facelifts and lower facelifts. What is like the textbook definition of a facelift? And do all of these different types of surgeries have one thing in common?
Oh, great question. A very big answer. So there is no strict definition that a facelift has to include certain aspects. So it is kind of what you make of it. And I think it has also changed through time. So we are fairly specific, and a facelift is something that improves both the cheek and the jawline area and the neck. But it's independent of any surgery on the eyes. Okay, so that's not part of a facelift. Those are eyelid surgeries. So a facelift itself probably has an incision in front of the ear, behind the ear for tightening the skin in each of those areas, and probably one underneath the chin. That just depends on your anatomy, whether you need that or not. So we break that down into, if it's really your neck's in great shape and you're just trying to improve stuff in the upper cheek or the jaw, well, that's probably just a cheek lift. Some people might call that a mini facelift. Some people would call that an S lift because of the particular type of stitch they do underneath the skin. Some people might call it a lunchtime thing. So some of it becomes marketing and trying to set yourself apart just based on that kind of a name of something. And then there's what it actually is. A neck lift probably doesn't improve the upper cheek or the jaw, but just improves the jawline underneath that area. So if there's anything in common amongst all those things, it's that they are all surgeries that have an incision and a removal of skin. Now, for us, speaking for myself and all my partners, because we do a lot of these things in very, very similar ways, we're not just doing skin-only facelifts where we cut out skin and we rely on the tightening of the skin for the improvement. We lift the skin up off of the underlying structure, and then we fix the structure underneath. So kind of like fixing the foundation on a house. You get all that shored up, and then we just happen to have extra skin that we get rid of, and we're not putting tension on the skin, therefore you get better incisions and scars. So going by terminology, you're not going to be able to go to Dr. A and compare their exact same wording to Dr. B, because the product that they're offering may be completely different.
And you talked about how you all do it the same way. You're not just pulling the skin and tightening it. Can you kind of go over exactly the process behind a facelift and what you're doing as far as both like with the skin, but then also improving the foundation?
Yeah, that's part of the consultation with the patient, is helping them to understand the differences between what we're doing and what they might be seeing somewhere else, or what they're reading as they come in and they say, hey, I want this particular type of thing. And you'll say, okay, that's what you want, but let's just understand what that actually means and what that's composed of, and what I'm offering as a possibility or an alternative to what you're thinking.
And are there any sort of special cases where you might have to say you're maybe not the greatest contender for a facelift? I know it's person to person, but what might make you kind of push someone in a different direction?
So there are some people that really just don't need anything, as we would say, as aggressive as a facelift. So there are alternatives to that. Some people are bothered by the fold or along the nasolabial smile line area, but it's so early and so modest that adding an incision and thus a scar at a place, even though it's a really good scar, may just not be worth it in my mind. I try to make sure that we're of the same mind of that, or at least see where they are about it. Because some people be like, no, I want it as tight as possible. I don't care if they're okay. All right, we've had the discussion. You really do understand the trade-offs. But there may be a person that just needs to have some filler. They may just need to have, if they have some fine lines and wrinkles, maybe it's a skincare system. Maybe it's a light laser peel or a chemical peel for some of the areas. So it's probably best not to come in and ask for a particular procedure. It's probably best when you go to whomever you're seeing to go in and actually just point out the things that you don't like. And so just help that person then to offer the alternatives for those options.
And does a facelift last forever?
It lasts forever, and it lasts for 1 minute. And
You've been asked that before.
Oh yeah, absolutely. Because the answer it lasts forever is that you're always going to look improved over where you started. But aging takes off right again. So we really want people to have the understanding that cosmetic surgery is not a one-time thing. It can be. I mean, you can do it just one time, but it's not like it's once and it's done forever, and you're always going to look just like that. Nope. It's going to happen that you're going to age, and you're going to age at different rates at different times based upon environmental factors, based upon hormonal factors, based upon stress in your life. It's known that that's the way things happen for us. The big stressors, loss of job, divorce, death in the family, moving. People age dramatically during those stressful times, probably for a variety of reasons. Some just stress hormones. Some you just don't take care of yourself, as well during those times.
Is there a way of maintaining your skin a certain way if you get a facelift to kind of, because of course we can't prevent those major stressors in our lives, but is there a way to maintain it so you can kind of get a bang for your buck? Yeah,
probably the best thing you can do is stay out of the sun. When you can't stay out of the sun, which is most of the time, you wear sunscreen, you wear a hat, you wear protective clothing. Avoid those types of environmental stressors. Don't smoke. As much as it's bad for your lungs and the other aspects, it's terrible for your skin. So do those. And then you do some self-care types of things. There are regimens that can help the collagen to stay healthy a little bit longer. So see your local esthetician, talk to your surgeon, your dermatologist, whomever you're seeing, about some of those skincare options so you can have a program. And see someone who will help you get a program that you will stick to. So for me, I can do 1 or 2 things. My wife can do 8, maybe 18. I don't know, but she really likes it. For me, it needs to be really, really simple, 1 or 2 steps.
And in another episode, Dr. Siegel and I kind of talked about the importance of starting with like a healthy diet, and I guess the importance of keeping your body healthy in addition to getting a plastic surgery procedure. When you're talking to patients, how often is that kind of embedded in your conversations with them?
It's probably less of a conversation when I'm talking to them about facial surgery than it is when we're talking about body surgery. Because that's kind of the issue that's in front of us at the time. So I myself probably don't, think about it enough and say, okay, good, we're going to do all this stuff, but you need to watch these other aspects, of your lifestyle. I haven't become that lifestyle coach yet. But if we are talking about doing a surgery for somebody that's lost weight or somebody that's losing weight, or we're doing liposuction, then we will have some talks about, fitness, about diet, about those types of things. I used to say a lot more when I was younger, that you can eat faster than I can suck, because that would be the questions like, is this liposuction, how long is it going to last? It's like, well, you know what, you can definitely out-eat me. And we've seen people demonstrate that, but we've seen as many people also demonstrate their ability to take whatever we do and then make it better. And that's really rewarding.
Well, thank you very much.
Yeah, thank you.
Hey guys, thanks for tuning in to this episode of Austin-Weston's New You Now podcast. If you liked what you saw or heard on today's episode, please like and subscribe to our channel. And if you have any questions about any of the topics we've covered today or in past episodes, send us an email at hello@austin-weston.com or just leave us a comment below. See you next time.
For more information, visit austin-weston.com or call our offices for a consultation, 703-893-6168, and make sure to subscribe to our podcast series, Austin-Weston, the Center for Cosmetic Surgery.